Hi everyone, I'm back with my vlog, and this week I'm going to talk to you about hysterectomy. So we're back to women's problems at the moment. So what is it? A hysterectomy is a surgical operation where a woman has her uterus or womb removed. So it's a big piece of surgery. So why is it carried out? So there are lots of different reasons for carrying it out. One of them is uterine fibroids. So these are benign growths in the uterus that can get very big and they bleed and they can be very painful. And sometimes hysterectomy is the only answer. Endometriosis is another cause. Uterine prolapse, where the uterus slides into the vagina and can be really uncomfortable and beyond repair. Abnormal vaginal bleeding, chronic pelvic pain, thickening of the uterus wall, so this is called adenomyosis. And finally cancer. So if there's cancer of the ovaries, the fallopian tubes, the uterus or the cervix, a hysterectomy is the answer. So what type of hysterectomy would you have if you had one? Well, there are different types depending on what's going on and what the reason for the surgery is. So there is a subtotal hysterectomy where just the upper part of the womb is taken away. Then there's a total hysterectomy where the entire womb and the cervix is taken away. And then there is a radical. In a radical you will lose the uterus, the surrounding tissues, some lymph nodes, the cervix, the upper part of the vagina and possibly the ovaries and fallopian tubes. In any hysterectomy the ovaries and fallopian tubes may also be taken. And taking away the ovaries is called an oophorectomy, and taking away the fallopian tubes is called a salpingectomy. So if you were to have a hysterectomy where you lost everything, that would be called a hysterectomy with a salpingectomy plus oophorectomy. So lots of massive words, but basically it means a hysterectomy plus the ovaries and the fallopian tubes. So the questions to ask your surgeon when they're choosing what type of hysterectomy for you is, why are you choosing this particular type? What are the benefits versus risks for me in particular? Can I keep my ovaries? And this is really critical because although hysterectomies are more often carried out in slightly older women, they can be carried out in younger women too. And if you take the ovaries, you will go immediately into menopause, whatever age you are. Even if you leave the ovaries after a hysterectomy, because there's an interruption to the blood supply, there's quite a high chance that you will go into menopause within 5 years. Again, regardless of what age you are. So this is a really important thing. And then of course, is this the most minimal surgery that you could do for me? Because you always want the most minimal surgery for your health, for the length of the anaesthetic. So then what surgical technique will the surgeon use? Well, that really depends on the reasons for doing the hysterectomy, your history, what their experience is, what your overall health is, and also what your weight is. So those things will all come into play when making that decision. And there are 3 different ways of carrying out this surgery. So there is a laparoscopic surgery, there's vaginal surgery, and there is abdominal surgery. So laparoscopic surgery is the gold standard, it's the preferred method. And this is where small incisions, 3 or 4, are made in the tummy wall. And a camera goes into one of them, that one usually through your belly button, and then tools go through the others, some gas is inserted into your abdomen, and the surgery is all carried out through these tiny holes. So it's minimally invasive and you do need a general anaesthetic for it usually. Then there's the vaginal method, and this is where the womb and the cervix are removed via the vagina. So like when you're having a speculum exam at the GP, all the surgery is done that way. Small holes are made at the top of the vagina so the surgeon can get access to the different ligaments and make the incisions that he needs, and then afterwards these are just sutured up. This can be done under a general or a local anaesthetic and sometimes even a spinal anaesthetic. So like when you're having a caesarean section and you have a spinal anaesthetic. And then finally there's the abdominal hysterectomy. Now this is the biggest surgery and has the longest recovery time as a result, but we'll talk about that. So it's an incision that's made in your abdomen. It can either be done at the bikini line, like a caesarean, or it can actually be done up the middle, so a line that goes this way. And that will depend very much on the reason for you having the hysterectomy and whether you have big fibroids, etc. you will need a general anaesthetic for this without a shadow of a doubt. So the questions to ask once the decision has been made is, what kind of preparation do I need? Do I need to start medications, stop medications, lose weight, stop smoking, all of those kind of things? What type of anaesthetic will be used? How long will the surgery last? How long is the waiting list to have this surgery? How long will I be in hospital? How long will it take me to recover? When can I go back to work, drive, have sex? Will I need smear tests afterwards? And if so, when? How many? And will I have scars? So those are all the questions. And write them down and go through them one by one. Don't be rushed. This is your life, your body, your surgery. It's really important. So before any surgery, what can you do to make it go as smoothly as possible? Well, be in the best of health. Eat a really healthy, balanced diet. Stop smoking. Exercise regularly. And if you need to lose weight, try and lose some weight. You'll probably have a pre-assessment at the hospital where you'll go and they will check all of these things for you. Do an ECG of your heart if needed. Speak to the surgeon if needed. You need to think about travel arrangements to and from the hospital before and after surgery, who's going to help you and what support you can have in place at home. And then after surgery, what to expect? Well, immediately when you come around from the anaesthetic, you'll possibly be in pain. You could have a catheter, that's a tube into your bladder. You could have drains in place to take away fluid and blood from the surgery site. You'll feel a bit groggy, you could have a headache. You'll possibly have a gauze pack inside your vagina, and your wounds will have dressings on them. And all of these things will gradually be taken away over the next few days, and the nursing staff will talk to you about them and help you with them. In the few days after the surgery, you'll be encouraged to mobilise as soon as possible to prevent getting blood clots. And you need to be sensible. Don't do anything that hurts. If it causes pain, don't do it. It's your body telling you to stop. And then prior to discharge, you'll need to have a list of all your medicines and a prescription for them supplied. You'll need to know what the rules are, what you can and can't do, and what to expect. You'll possibly have some physio follow-up booked, and you need to know when that is. And you'll need to have your support at home, especially if you've had an abdominal surgery, because you will be able to do very little for a while. So to give you an idea, the timings on these, if you have a vaginal or a laparoscopic surgery, you should start feeling back to normal-ish within about 4 days. And your GP follow-up will be in 4 to 6 weeks. If you have an abdominal surgery, you're going to need 6 to 8 weeks recovery time, and you will need that. It's a big surgery. And you will have follow-up at the hospital at the end of that period with the consultant to check how things are going. So again, questions to ask before you leave. And again, write them down and take your time. Don't be rushed. So, who should you contact if you're worried? It's really important. What am I allowed to do on my own? What will I need help with? What can't I do? Be very clear so that you know. How much pain, bruising, swelling is normal? What should I expect? And when should I worry? When should I contact someone because I think it's more than that? Do I have any stitches that need removing, and when do they need removing? And your GP/nurse can do that for you, but we need to know when and where. When can I go back to work? When can I drive? When is my follow-up and who is it with? And if you've had your ovaries taken away, will I be starting HRT? When will I be starting it? What will I expect? So lots of questions, so write those down and take them with you, and don't be rushed. And then at home, what to expect. So you can expect vaginal bleeding or discharge for up to 6 weeks. It won't be as heavy as a period, but it will be there. You might have some bladder or bowel issues. So because you've had a catheter in, you might start getting the symptoms of a urine infection. So pain when you pee, pain in your tummy, fever. And if you get any of these, speak to your GP immediately because you will need treatment. Your bowel might have shut down a little bit, so you might be constipated because when the bowel was touched during the surgery, that often happens. And obviously you've got pain medication, which will also be making you constipated. And it's really important that you don't strain when you're going to the toilet because you don't want to undo anything that's been done down there. So take laxatives and make sure you're not straining. And another tip I can give you is when you do go to open your bowels, just use your hands across your abdomen to give yourself some support, to just make it feel that much easier. You might be going into menopause if you've lost your ovaries, so you could be experiencing hot flushes, night sweats, mood changes, anxiety. So all of those things are really important, and if you are experiencing them and you haven't got a plan in place, see your GP. And emotionally, you might feel a bit run out. It's a big surgery, and also it's a big change in your life. You've lost your womb, you've lost your ability to carry a child. Some women find that really difficult to cope with. They feel less womanly as a result. Their mood swings can be massive. You can be tearful and you can be depressed, and this is all understandable. But please speak to your GP ASAP, because we can put in place some counselling for you, and if necessary, tackle the depression as well. So it's really important, and it's completely understandable, completely. So when can you get back to normal? As soon as possible, obviously, but there are some rules. So people ask when they can exercise again, and we do want you to get back to exercise because exercise is good for you all round, mentally and physically. So what we say is once the wounds have healed, get into walking and swimming to start with, and then gently ease back. Obviously, if you've had an abdominal hysterectomy, you need to take it easy for 6 to 8 weeks before you do that, but you could swim or walk. Lifting, again, be careful, be sensible, don't do anything that hurts, and if you've had an abdominal hysterectomy, don't lift anything heavier than a full kettle for 6 to 8 weeks. Driving, and this is the question we get more often than not. So what we say is that when you can comfortably wear a seatbelt across your tummy, and you can do an emergency stop, so slam that right foot down hard, then you're ready to drive. Excuse me. Don't drive before then because your insurance will be invalidated, and that's really important. When can you have sex again? Well, wait till your wounds have healed and your vaginal discharge has stopped, and then go back to sex. Be gentle at first because obviously you might be a bit sore, but after that it's back to normal and you don't need contraception anymore, so there's a plus side. And working. See how you feel, judge it yourself and be guided by your body. If you're in pain, have some time off and relax. Don't do anything that hurts, and if you have a job with heavy lifting, you will need 6 to 8 weeks off because you won't be able to do that. But if you've got a sedentary job, you can go back to work once you feel well enough. So complications. So obviously because you have an anaesthetic, there is always risks that come with that, and these will all be explained to you before you have your anaesthetic and surgery. But those risks include things like nerve damage, allergic reactions, and in severe cases even death, but that really is very, very rare. Ureter damage, so that's damage to the tube that comes from your bladder to your kidney. That's usually repaired at the time, and the risk is about 1 in 100. Bowel or bladder damage is also possible, and this can lead to things like urine infections, incontinence, frequency, and in really rare cases, but at the severe end, you could need a catheter or a colostomy bag. Bleeding that needs a blood transfusion can happen. Infections of your wound or obviously of your bladder, and if you get these you'll need to be treated with antibiotics. Blood clots because you're having surgery and you're immobile, and that's why we get you up as soon as we can. Slow healing, vaginal prolapses are rare but they do happen. And then obviously, as I've said before, there's a risk of going into menopause within 5 years because of the blood supply to the ovaries being interrupted, or if your ovaries have been taken going into menopause, which is a dead cert if they have. So those are the complications. Now what about smear tests? Now this is a complicated area. So I'm going to try and give you a quick overview, but I'm going to put a link in the details afterwards so that you can have a look for yourself, because it really does depend on what your smear history is and what kind of surgery you've had done. So if you still have a cervix, you will need to have your smears as normal for the rest of your screening life, so up to 65, at the recall that you would normally have had. So that one's quite simple. If you don't have a cervix left anymore and you've never had a history of what we call CIN, so those are a particular grade of precancerous cells on your cervix, and that your smears have always been normal in the past, you don't need smears anymore. If, however, your smears have been abnormal in the past, but you didn't have CIN, you'll need what we call a vault smear at 6 months, and if that's normal, then no more smears. If, however, you've got a previous history of CIN and you've had your cervix completely taken away, you'll need a vault smear at 6 months and 18 months. Then if those are normal, you'll go to no smears. If, however, you had CIN in the past, but the excision of those cells was incomplete or uncertain, you'll continue to have smears. And depending on whether that was CIN 1 or 2, 3, depends on how often. So these will be vault smears at 6, 12, 24 months if there was incomplete excision or uncertainty. And if it was CIN 2 or 3, 6, 12 and 9 months, and then annually. So as you can see, it's really complicated, and there is a link in the notes afterwards. I hope I haven't confused you there, but hopefully I've given you an overview. So it's a big surgery for sure, and it needs thinking about before you have it. But for some women, it's just absolutely necessary. Everything else has been tried and there is no other solution. So it's important, and it changes your life. Because on the plus side, for most women, as I said, this is life-changing surgery where the terrible pain, bleeding, bloating, feeling unwell goes away because it's all been the cause of it is being taken away. So that's the most brilliant thing about it. I speak to women who after their hysterectomy have almost started life all over. Also, it enables you to have estrogen-only HRT, which is also life-saving, takes away the menopause symptoms, keeps your bones healthy and strong, and doesn't come with the risks that progesterone brings. So that's another plus side. And then, excuse me, I've had a cold, as you can tell. Then it also prevents uterine cancer, and if you have your ovaries taken away, ovarian cancer. So you never have to worry about that cancer that all women, are at reasonably high risk of in their lifetime. So it's life-changing and sometimes life-saving surgery. So although it's complicated and there's loads of things to think about, for many women it's a no-brainer. It's their last opportunity to get rid of everything that's been driving them absolutely crazy. So hopefully today I've given you the questions to ask before, during and after the surgery, given you an idea of what to expect and what to do. I'll put some links to useful sites afterwards, including the smear one, and ask me any questions you've got and I'll try and answer them. And I hope that's been as useful as ever. Thanks for watching and have a really brilliant 2018.